On the air. There have been many challenges we have faced since the dawning of this new century. In my opinion, one of the greater trials has been the acknowledgement of dementia and its impact on our community. Joining us to discuss this issue is a local leader in the field of dementia, Miss Marie Fay, and Miss Erica Fulton, who is the director of Dementia Bermuda. We will meet Miss Fulton in the second half of our show. But right now we turn our attention to Miss Marie Fay, who happens to be a repeat visitor, I thought. Maybe not. Anyway, welcome once again to Health and Family.
Thank you so much for having us today.
Yes. So dementia, it kind of, I get a little sad when I say the word, because as we were talking off air, it's affected so many people in little Bermuda, much less the whole world. But of course, we'll start off by defining what dementia is.
Sure. Dementia is definitely a growing community care crisis for us, not just locally here in Bermuda, but globally. Dementia is an umbrella term, actually, that is used to describe a grouping of symptoms that affects our brain function. So one that we hear about the most would be memory loss, but that's not the only symptom that we see. And you actually have to have more symptoms than memory loss to receive a formal diagnosis of dementia. Other things that we might see are changes to speech and language skills, changes to attention or concentration, mood and behavior or personality changes as well.
Can we sorry to interrupt you. I wanted to talk about the speech and language. So what happens to an individual? Do they sort of start to maybe stutter or lose their train of thought? Or one of the things, I thought I interviewed you, maybe it wasn't, but I remember speaking to, I think, Liz, as you said, and I said, but sometimes I'm searching for words. And she said, that's not a big thing to really worry about. Yeah. And that was many years ago. But so can you just expand on that?
Sure. It's challenging because dementia is such a broad topic. There's many different types of dementia or diseases that will cause those symptoms of dementia. Speech and language skills are something that can be impacted in Alzheimer's type dementia, which is the most common form of dementia. We do sometimes see mild word finding challenges, difficulties naming familiar or everyday items, that sort of thing in the early stages. But as the condition progresses, because it is a progressive condition which we expect to change and worsen over time, people can have more significant issues with communication. They may not be able to express themselves verbally, but they might also have difficulties understanding or comprehending verbal information that's provided to them. So it's a really important thing for us to be aware of as supporting community members if we're interacting with individuals who have dementia.
Yeah, I like that. I like that definition. I think you got it. Why does dementia occur? What's going on in today's environment? In the intro, I said the dawning of the new century, but it has happened prior to that. Maybe not as much PR publicity with it. Go ahead.
So I think there's a lot of influencing factors here when it comes to dementia. Dementia has been around for more than 100 years. Oh, wow. But we are seeing the incidence increase over time. Globally, there is approximately 55 million people who are currently living with a diagnosis of dementia. But the truly scary thing is that that number is meant to double every 20 years, along with the world's aging population.
Right.
And we're seeing very similar statistics in Bermuda as well. But there are a number of reasons, I think, why we're seeing this increase. Right. Number one is the aging population. And the other thing is stigma-wise. There's still a big stigma attached to dementia. In years past, perhaps we didn't call it dementia. Perhaps we called it Alzheimer's or senility or, but we are slowly over time, especially as an organization, Dementia Bermuda wants to really open up the conversation about dementia and brain health generally, and that we could become more comfortable talking about our brain health like we are with, the rest of our physical health.
So as far as Bermuda, I know you're in charge of, give us the name of your organization.
So I am currently clinical director for Dementia Bermuda, which is the nonprofit organization. But I am also a community-based therapist. So my primary role is actually going out into the community to conduct dementia assessments within the homes of people that are living with dementia. And our goal is to try and maintain their independence, their safety within the home environment for as long as possible, and providing that critical caregiver education and support that is required as well.
Please let's spend some time on that, if it's not now, but a little later on, because I am concerned as we watch our aging population just walk around, and you're saying to yourself, are they okay? Do they know where they are? All these questions come to you because sometimes they just seem out of it, like bewildered. They don't know what's what, where they're supposed to be, and all that. But anyway, how many people do you estimate have dementia? I know it's a broad estimate, but if you could in Bermuda.
We don't do a great job of collecting data, and it can be difficult, especially with dementia, because individuals can have a lot of other contributing medical factors. We would estimate, based on our population size and the risk factors that we have here, that there's around 3,000 people who are living with a diagnosis of dementia. And
that's pretty big though for our size, right?
And we're hoping to collect more concrete data to support that over time. But it definitely is a massive community issue. We're getting calls daily, not just from concerned individuals themselves, but concerned community members, organizations, agencies, banking institutions. It seems to be touching every segment of the community.
Would you be able to break it down? So if we're just estimating 3,000, would you say the majority of those are women that have dementia, or is it men, or?
So in terms of demographics, and again, we're trying to improve our data collection in that area, women are predominantly impacted by dementia. They say twice as many women will receive a diagnosis of dementia as men. Right now they're saying because our life expectancy is that much longer, that's one of the risk factors. But we also know that socioeconomic factors can impact lifestyle factors, access.
How does socioeconomic? Because if you're richer, you're more bound to get it, or vice versa?
So there's a lot of lifestyle factors that we are learning over time that we can share today in terms of modifiable risk factors. But a lot of those link to things like obesity, hypertension, diabetes. We know in Bermuda we have large numbers of individuals that are impacted by those. And if you have that, if it runs along your family lines, you are much and more increased risk.
Oh wow, that's I didn't know that. I didn't know obesity was a part of it as well. I didn't know that. Obviously some smoking, drinking, all of that too.
Recently the Alzheimer's Disease International, which is sort of the global research organization for dementia and Alzheimer's, recently relaunched a information report about the risk factors.
Right.
Previously, there had been 12 modifiable risk factors, but they've actually increased that now to 14. But the important point about this is that if we were able to mitigate these risk factors that they've detailed in this report, we could reduce our personal risk of developing dementia by up to 45%, which is huge,
yes.
right? When you think of a condition that we often feel like we don't have as much control about, or we don't know enough about, things like you've mentioned alcohol consumption, smoking, physical activity, inactivity. There's things like air pollution, head injury, which in Bermuda with our road traffic accidents and things are a big thing. Infrequent social contact, so loneliness and isolation can increase our risk of developing dementia. And when you think, I think the last time we crossed paths was during COVID.
Yes, that's what I was.
You know, when we were really encouraging this population to remain at home for their safety. You know, we've seen the negative impacts of prolonged isolation on people's brain health and cognition.
You just never put the two together, and now, it kind of makes sense. I actually do understand the loneliness because if you have nobody to communicate with, you're going to kind of...
It's all about stimulation.
Yeah.
And the other things that they've added as well was relating to vision loss and hearing loss. Again, two things that you wouldn't necessarily think would have a direct impact on your brain health. But if you have even minor hearing loss, that can impact our stimulation, our cognitive stimulation. So these things are really critical for us to be monitoring and addressing if they are an issue for us.
It just brought me to, as I mentioned to you earlier, I am a school teacher and I do a grounding exercise where I'll ask the kids to point out 5 things they see, 4 things they hear, and so that is something that you know we all could get ourselves involved in to kind of make it current, right?
This is what we really want to do as an organization, is have people thinking about brain health, just like they do heart health or physical health from primary or primary school age. We need to understand that our brain is like any other organ or muscle. It needs to be nourished, it needs to be hydrated, it needs to be taken care of, and that there's ways in which we can keep it strong as we age.
And so I guess, did I ask you why does it occur? Why does dementia occur? We talked about the demographics. We did talk about more women than men. Can you answer to more the race factor? Is it more blacks than whites?
Yes, so that is definitely what we're seeing here in Bermuda, but also globally. That the black population are more significantly impacted than other populations, minority populations.
And you think that's because of the environmental factors?
I think there's some socioeconomic factors that influence that. We're certainly seeing that here in Bermuda.
All right, so how is it diagnosed? I think everybody would be interested to know, how does it actually get diagnosed? When should somebody get concerned and say, my mom has been forgetting, what should I do? Take us through that.
So this is really, I'm glad you asked that, because diagnosis can sometimes be very complex, right? We have a lot of gaps in our current health and social care system. There is no care pathway for dementia. So it's not as if you go into your annual physical every year and they ask about brain health or memory, or that's just not sort of a standard process right now.
Maybe it should be though,
So,
right?
well, really, this is what we would love to work towards. But oftentimes it is family members that pick up on those initial signs and symptoms. Like perhaps mom is repeating information, or we provided some information about an appointment time and they forgot to attend, or they forgot to pay a bill, or they overpaid bills. So in terms of diagnosis, there's no single test for dementia. It's basically a process of ruling out anything else that could be causing symptoms, of which there is some. Vitamin deficiencies, infection. There can be a number of other things that can impact our brain health that don't lead to a diagnosis of dementia necessarily. But what we would want is for the individual to go to their family doctor, to have a conversation, to have a full medical workup, blood work, urine test. Some doctors will refer on for brain imaging to look to see if there's anything obvious in terms of vascular incidents within the brain or stroke history. But based on that, through a process of elimination, they are normally able to say whether they feel it is an underlying dementia or not. And cognitive testing, I should have mentioned, is part of that as well. There are
that involves?
So there's some pen and paper exams that look at cognition. So some doctors use different types. There's a number of different tests out there, but it looks at things like short-term memory recall. It might ask you to remember some words or a name and address and then come back to it after a few minutes to test your recall. There's other parts of the test that look at like visual spatial awareness, because that can be impacted with dementia as well. So that's also a common part of the assessment process.
So I think the last time I spoke to you or Liz, I was saying sometimes there's a word I'm looking for and it doesn't come to me, and maybe 10, 15 minutes later, it'll come to me. And so I believe Liz reassured me, you're okay.
Yes.
So I just want to make sure that's okay.
This is great, because our bodies, as they age, there is going to be some normal age-related decline. And we have a lot of people who reach out to us to say, I'm noticing these changes. Is it something I should be concerned about? I mean, I think brain health should always be something that you feel comfortable having a conversation about with your family physician. But the odd word finding issue or forgetting where you put your keys is not necessarily an indicator of dementia. What you will see with dementia is that it continues to progress over time. It's more than just a memory issue.
Yeah. So take me through the stages. So initially, mom, your daughter or somebody says, Mom, I'm concerned that you're forgetting things. You mentioned dates and all that. So that's clue one, or it's
might be an early warning sign.
Right.
Yeah.
And then, so take me, what else happens?
So in terms of dementia staging, there's a lot of different scales that are used. As a kind of healthcare professional, the way I view it is that we're looking at sort of mild, moderate to severe or end stage, because it is a progressive and terminal condition. In the early stages, which is when we want to interact with people, that would be the ideal, is seeing people early on. We are able to try and put those coping strategies, those compensatory strategies in place to keep people independent, even with a degree of cognitive decline. So I will visit with them at home, we'll look at their home environment, we'll look at their routine. We don't want people withdrawing and becoming more socially isolated, because that actually could happen. Of course. Can make things worse over time.
Well, because and I'm not saying you're impeding, but you're going into their home, which is generally a very private place.
Yes.
But you're doing this for their benefit to see how it all works. Take me through that, because I want the audience to get a picture of that. How when you're assessing, what are you looking for specifically?
Yeah, it can be very, very challenging to get in there to get a real picture of how somebody is managing with their daily activities, because with a progressing dementia, it will impact somebody's abilities to perform their daily tasks. You might see a change to their personal hygiene or their personal care. They may not, you may go and see them, and normally they would be, sort of well put together, and you notice these changes in somebody. But it can, it's about building that rapport, and what we want to emphasize is that by getting in there early and providing the support early, by having those head-on conversations and putting those supports in place, we work with a lot of people that live well, continue to live well with a diagnosis of dementia and maintain a good quality of life. What we want to prevent is people getting to those crisis points, where families are burnt out, or people are having safety concerns as a result of the dementia.
So is there, and I think I know the answer to this, but is there a support system for both parties, for the parties, the daughter who's concerned about the mom and
Yes.
the individual who is experiencing dementia-like qualities.
Yeah. So, I mean, you've asked about staging. So in the early stages, our focus is obviously on the client, right, and
Right.
setting them up. But as the condition progresses, our attention has to turn to those supporting family members. We cannot effectively treat somebody
Right, of
with
course
dementia
not.
without also educating and supporting the family members. So through Dementia Bermuda, we are able to offer not just support services for the individual themselves, but a big piece of what we do is caregiver education and support. We do that in two different ways. We have a monthly caregiver education and support group.
Where is that at?
It's held at the Argus Hub building, which is located at 12 Wesley Street next to City Hall parking. And that's in the evening from 6 to 8 p.m. On one Tuesday a month.
Okay.
And we spend the first hour covering an education topic that pertains to dementia care. And the second hour is more of a caregiver support forum. It's been very well received and very well attended. And just that people knowing that they're not alone.
Makes a huge difference.
Yeah. The other way we support is through our community-based program, because we know everybody with dementia is an individual. Their social circumstances are different. Their home environment is different. So if we're able to get in and see people and see how they're managing and see how they're functioning, we're then able to provide that sort of personalized care plan to try and help maintain things over time.
Kudos to you and your team for going out, and I think it's Peace Lutheran, if I'm not mistaken.
Yeah.
And you do dance or exercises or art. Talk to me about that, because I'm actually on your mailing list. I don't know how I got on it, but I do look at it to see what's happening. So talk to us about that.
So meaningful engagement, cognitive stimulation, stimulating our brains in new and different ways, is one of the primary treatment options for dementia. It's actually better than any medication that's available on the market currently, without the negative side effects that we can sometimes see with drug interactions. So Dementia Bermuda offers a free daily activities program at Peace Lutheran Church. There's a calendar that goes out every month. And the idea is to give people a safe place where they can bring their loved ones who have a diagnosis of dementia, no matter what stage, whether it be early, right the way through, and an opportunity for them to participate in an activity that we know is beneficial for brain health and can help to reduce some of those behaviors that we often see with dementia, like depression, anxiety, agitation, aggression, those sorts of things. So we often provide 2 sessions a day. One is more of a music-based activity typically, because we know how beneficial music can be.
Oh, say that again.
Yeah, yes, it can. It's medicine.
I love it. I actually walk to music. It makes a big difference.
And it stimulates our brains in different ways.
Yeah, that's a good thing to hear.
But it promotes, people who have issues communicating can sometimes sing perfectly well.
Yeah, I really give you kudos for that, because that's exactly what I think the community was crying out for. They to have a place where their loved ones can go and to be able to participate in activities, the art, the music, the exercise. Actually, I think Frances.
Yes.
I used to go to her too. Yeah. She does.
We would love to be able to continue to evolve and expand that program, because there is such a community need for it.
Real.
And especially dementia-specific services, which we don't have a lot of here in Bermuda currently. But it is a specialized skill set, right? It involves a sort of good understanding of the condition and how it presents.
Yeah, so it looks like that's going to be, well, I'm sure people are studying specifically dementia and Alzheimer's and so forth, because as we've mentioned, there's such a need to know how to work with people that have this, correct? Yeah.
Yeah, absolutely. We are definitely seeing some movement in the community. We are doing a lot of advocacy work to try and push dementia to be the national health priority that it needs to be. It is having such a significant impact on our health system. We're hearing stories about the hospital beds being full of individuals that require social support, and that's because we really are asking people to do the impossible currently. To support their loved ones within the home environment without the necessary training or education, and we don't have that social support system in place for people.
So I think Liz was, I think it's Liz
now. Yes, yeah.
I have a little,
Which
sorry.
makes me feel better.
Yeah, I think it was Liz. I kind of remember the name Liz. But she was talking about the caregivers that currently, if you wanted somebody to help you out, is that like a requirement for them now, the caregivers, to be able to be versed in dementia?
So there's different levels of caregiver training. I mean, the facts are that 80% of dementia care in Bermuda is undertaken by unpaid family members, many of which are women, you know, who are that sandwich generation, taking care of their own families and job roles and that sort of thing. So there are some initiatives out there through Future Care and that sort of thing that can help to reimburse the time of family members who are providing that critical support.
So is there any training for this?
So there is a registration process, you know, that's required for family members. There are also qualifications, training programs for certified nursing aides and nursing programs that provide that more specialized dementia care training.
I'm sure you can get some information online as well.
Yep.
I'm thinking.
Yeah.
Alrighty. So is this hereditary dementia?
So we get this question a lot,
I'm
you know,
sure, because
people
are
say,
concerned. Yeah.
So good news is that it's a very minimal chance that dementia is a direct genetic link.
Okay.
Less than 1% of cases are directly genetically involved. But what we are seeing, especially here in Bermuda, is that we have high rates of these risk factors that run through families.
Right.
So things like hypertension, heart disease, diabetes, obesity, those sorts of things. And that's what can make it seem like there is a hereditary link, but actually it's just a check box on the risk factor list. So that should be empowering, you know, that we are, if we're able to reduce our risk factors, you know, if we're able to be proactive with our brain health, we have some degree of control over whether we will develop dementia in future.
Alrighty. So we're going to meet your coworker, your go-to person, I'm thinking, Ms. Fulton, and she's going to talk to us about what it entails to be a director of Dementia Bermuda.
Yep.
All right, so we'll take a break right now. We'll be right back. Stay tuned.
Thank you.
When I was growing up, my mom was extremely tidy. We were trained to put things back where we got them from. One day, when I walked into my mom's house, I felt like I walked to someone else's house. There was stuff everywhere. And just growing up the way I grew up and to see this transition was very alarming.
When Sean talked to me, it was a wake-up call, and that's when I went to the doctor.
You're watching CITV.
Hi everyone, welcome back. If you're just joining us, Miss Erica Fulton is here with us. She is the Executive Director for Dementia Bermuda. We want to welcome you, Ms. Fulton, to our program and start off by asking you, what does that entail, being a director of dementia, executive director of Dementia Bermuda?
Well, thank you. Thank you for having us. So I've been with Dementia Bermuda for just over a year. The organization was founded in 2012, and it was actually founded as Action on Alzheimer's and Dementia. By our founder, Liz Stewart. And so over this past year, after I joined, we were kind of really took a step back, and we said, recognizing, as Marie's kind of talked about through her segment, the impact that dementia is having in our community and the lack of resources and the lack of support services that are in our community and what we can do to really address that. So we kind of stepped back. We had new board members come and join, and I became executive director, and we've had Marie come on as our clinical director. And with that came our new name, Dementia Bermuda, much more clear who we are and what we represent. So my role is really about looking at us as an organization and what we can do to be the most impactful for people who are living with or affected by dementia in Bermuda. So what are the services that we're providing? Are they a broad spectrum of services? And that's something we've really, with Marie's guidance as our clinical director, really been looking at, how we want to be able to help people from that moment where they're perhaps concerned about a diagnosis right through to the end of life support as well. So my primary role is at fundraising. We can identify what is it that we need to do, and then a big part of what I need to do is then also ensure that we have the funding, the finances in place to be able to provide those services. So,
and are you also responsible for PR, public relations?
Yes,
yeah.
We are a small
really
little band at the moment. Marie and myself. And we have a wonderful network of volunteers. We have a daily activities coordinator, part-time daily activities coordinator who runs the Peace Lutheran program that you were talking about, Rebecca Lawrence.
Okay.
Yep. We're very small, but we have very big aspirations. And Marie touched on, we estimate there are about 3,000 people living with a form of dementia in Bermuda, and that number is predicted to double within the next 5 years. So we are knowing that people are struggling today. That there are people out there who don't know where to turn, where to go. They feel isolated and alone, and we need to do better, and people deserve better. And we're really here to kind of shine that spotlight on dementia, talk about it, get our community talking about it as well.
I think you're definitely on the right track, because when I did interview Ms. Stewart many years ago, I remember being a little outraged, like, well, where is the attention this deserves? And so you guys are definitely doing that, bringing a lot more attention to it as part of the government target, if I could say that. So I do applaud you guys for that. How old do you think a dementia patient, I guess it depends, but on the average?
So typically, Marie touched on a number of risk factors.
Right.
Age is the primary risk factor. So we typically are looking at 65 plus, but we hear it a lot in the press. We know that there is
younger people,
onset dementia, and the youngest person that Marie clinically has supported is 41 in Bermuda. So with a formal diagnosis of a form of dementia. So, we say that any age can be affected, and we certainly know that caregivers, Marie again mentioned 80% of caregivers, dementia caregivers in Bermuda, are unpaid family members. So we know that the numbers of those ages of those people, can be much younger as well. So really, when you're thinking about who's affected by dementia, it's our community across the spectrum. But yes, in terms of an actual diagnosis of somebody, we would more typically expect them to be 65 plus. And we just, part of those annual checkups with your doctor, when we're thinking about all the things that we are asking about when we're 65 plus, getting that brain health question in there. How are things going with your brain? How do you feel that, how are things with your memory? So,
no, it's just, it alarms me that this has been going on for so many years, and just recently, I guess through you guys, have put it in the spotlight. I hope it stays in the spotlight.
Yeah, and it's certainly a multi-stakeholder challenge that we're facing. This is not something that government can solve. This is not something that a nonprofit can solve. It's not something that insurance companies alone can solve. But each partner, each stakeholder has a really important role to play, and we know that 75% of the people that we help are underinsured or have no insurance. We know that within kind of an insurance umbrella that there is a lack of insurance coverage, and that people are struggling to kind of cope with what they're facing.
So recently there have been in the news of people who have dementia, who have gone out of the house maybe for a walk or whatever, and things have happened. What can we do to prevent that, speaking community-wise?
Yeah, I mean, I think one of the things that we're really fortunate in, that Bermuda is a very small community, and we still have a very grassroots based support, and we do have a lot of, family and neighbors who are looking out for our friends and families, and unfortunately, horrific tragedies can happen across the board, and sometimes there's just nothing that we can do. But what we can do in terms of us as a community is really thinking and talking about dementia publicly, so that we're all really aware of kind of some of the challenges that might exist. There are certainly, with the program that Marie provides, where we're coming into people's homes and helping them. Those are definitely things that we are discussing often, and what we can do to best support people. But sometimes, things are beyond our control in what can happen.
No, so I'm thinking of the house, and maybe I should have asked Marie, but the house look, like as far as deadbolt locks and whatnot to prevent, and I'm not trying to keep anybody a prisoner, obviously, if you want to go out, but just to prevent them from some individuals going out and just walking and ending up wherever.
I mean, I think what we would rather see more of are services that people can access. Day services. We know that Windreach, for example, has an all-day day service that they provide. I would be cautious, and Marie would be more skilled at answering this than me.
Okay, no, that's
but
fine.
Rather than locking doors, for example, and the safety risks that might come from that.
Do you think, or what are the experts saying about dementia? Can this be cured?
So, no, there is no cure currently. There are massive scientific breakthroughs happening all the time. We often hear about it in the press, and one of the biggest things, pharmacological or treatments that have been used with dementia up to very recently have been more symptom management. So depression, managing somebody's depression, helping with the symptoms of dementia. But what has been more recent has been disease-modifying treatments that are coming onto the market. They are still very much in the early stages. The efficacy is quite low. In terms of a cure, we are still probably a long way off of a cure. But as Marie said, with these 14 modifiable risk factors, if we can reduce our risk by up to 45%,
that's great,
through things that don't require that pharmacological intervention, that can be really empowering for us as a community.
Right. So many people are on the verge of retiring and getting, to themselves. What is your recommendation? You spoke about hobbies and what else, just to keep the mind active. Talk
That's
to us
such a
about that.
great question, and something that we really are passionate about. I think, you might hit the age of 65 and it's going to be your retirement, and for a lot of people that can be a loss of many things. That routine, the structure gets you out of the house. And those are huge, particularly in later life, those are huge risk factors. So, we really strongly encourage, if you're nearing those retirement years, really think about how you're going to fill your time. Not perhaps going home and just turning on the TV and staying in that one comfortable chair, which, when you're exhausted at work, we get it. Those are things that seem like are great options, but really in terms of our brain health, we want to stay engaged. Our daily activities program at Peace Lutheran is about getting people out of the home, engaging in something meaningful with other people. And so if we can do that as a volunteer, think about, your Monday to Friday, trying to get up every day at the same time, getting out of the house, or even if you're not volunteering formally, maybe you're helping people in your neighborhood, keeping purpose. I think we all thrive from that sense of purpose and meaning in our lives, and certainly with our dementia prevention, that's really critical.
Yeah, so you would advise to maybe join a group of some sort, a church or something, that where you can just still be active,
exactly,
and continue on.
Yeah.
So I'm going to finally ask you this one last question. So what can an individual do? They've just found out that they have been diagnosed with dementia. What is the first thing they should do?
We would love you to reach out to us at Dementia Bermuda. Our number is 707-0600. often people reach out to us when they're in crisis. You know, they have literally have nowhere else to turn,
Right.
and that can be incredibly stressful, obviously. And so, you know, we'd love to get people talking about their brain health, noticing those changes, and reaching out to us in those early stages. Another program that we provide is called cognitive stimulation therapy, and
talk to
it's
us about that.
for people in the milder stages, so those earlier stages of dementia, where there are. So it's a weekly program that's run also out of Peace Lutheran. We use their hall. And it's 2 hours once a week, and people come and, you know, talk about the news, and maybe they're doing recipes or things about daily living that are getting the brain actively working on something that gets those neurons firing in our brain in a really purposeful way. And it's, you know, it's a recommended protocol in the UK. If you receive an early dementia diagnosis, then you would be recommended to participate in cognitive stimulation therapy. We call it CST. It's also free, like all of our services.
Okay.
So it's really about helping the individual to try and delay the decline in their cognitive abilities. So these activities are all purposely designed to do that.
And of course, diet and exercise are
Absolutely,
very
staying
much
socially
needed,
active. But yes, please, if you are, maybe you haven't received a diagnosis, we do get a lot of phone calls where people are just really concerned and their doctors perhaps aren't listening. You know, it can be very difficult if you have a short window to see your GP to get across all of your health needs. Maybe there are other seemingly more critical health needs that get focused on. So please reach out to us, and we can try and help in whatever way we can.
That was actually one of my questions. If there was a specific doctor that treats dementia, or
Yes.
do you just go to your GP? And
So
then
the first protocol generally is going to be your GP.
Right.
There is the Mood and Memory Clinic, which is at BHB at the hospital.
Oh, okay.
And there's also Dr. Cousins Simpson, who runs Beams, which people also access in the community as well. So, yeah, your GP tends to be the first step in that process.
Alrighty. Anything else you want to add?
Yeah, well, we're grateful again that we can shine a spotlight on dementia, bring it to the foreground. We know that the numbers are only increasing, and we know that we're not meeting the needs of people today.
Alrighty. Thank you so much, Ms. Fulton.
Thank you.
Oh, wow. That's a lot. That's a lot. It's actually a longer show than normal. We normally just air for 30 minutes, but our producer felt that we needed to extend it as long as possible. So thank you.
Thank you.
Oh, gosh. Unfortunately, that will bring us to the end of our program here at Health and Family. We started off by talking to Miss Marie Fay, specialist on dementia, and we are concluding our program by talking to Miss Erica Fulton, who is the Executive Director for Dementia Bermuda. Suffice to say, there is a lot to cover on this topic. It is our fervent wish that a cure be found for this dreaded disease. I have no doubt that this will happen one day, maybe not today, but it will happen. But in the interim, we must do our due diligence and do our research to learn all that we can. Thank you so much for joining us. I'm Shay Burgess, and this has been Health and Family.